As one of the largest cable and internet providers in Belize, CBC strives to provide our customers with the highest standards of quality, value, and service in all aspects of cable TV and internet. Monitoring our systems closely, our technicians combine creative planning and state-of-the-art technology with years of experience and training to develop and provide the most reliable and advanced cable and internet service to exceed your expectations. For CBC and our team of talented engineers, technicians, and customer service representatives, delivering less than the very best is never an option.
To decrease your risk of being bitten by infected mosquitoes, use proven personal protective methods too. Apply an effective mosquito repellent to exposed areas of skin according to manufacturer's instructions. Wear light-colored long pants and shirts while outdoors in the early morning and late afternoons. Further, protect vulnerable family members like pregnant women, children, the elderly, and persons who are unwell by using mosquito nets to sleep or rest, even during the day. Fight the bite and protect yourself and your family too from mosquito-borne diseases.
Hey son, how was your first day at sixth form?
Really cool. It was great to see my friends, and I really love my teachers.
I'm so happy to hear that. I'm sorry I wasn't there for your first day, but I'll be back from Corozal next week.
It's okay, Dad. I can't wait to see you. Oh, and please remember, I still have some books I need to purchase.
Ah, yes. Let me e-cash you that right now. Money has been sent. I add a little extra cash just for you.
Whoa, Dad. Thanks. Got it.
You're welcome, sir.
Download the eCash app today and take your first step into a cashless lifestyle. For more information, visit www.e-cash.com or contact us via WhatsApp at 613-0257. eCash, the future is here.
Bringing people together has always been SMART's mission and passion. That is why we are proud to have built a locally independent quality network from the ground up that spans the country with over 100 sites. We continue to add more affordable mobile data packages, broadband speeds, and voice services to meet your personal and business needs. SMART has set the standard of true competition with the most competitive prices on all services offered. We invite and welcome you to join the SMART family, where the value for your dollar matters. SMART will continue bringing new technologies, more affordable prices, network expansions, and people together. SMART, bringing people together.
Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.
And we're back. We're moving into our second conversation for today, where we are going to put into focus the situation of mental health in the country and talking about the upcoming World Mental Health Day. We have with us psychotherapist with the Ministry of Health and Wellness, Juliet Simmons. Good morning.
Good morning.
Thank you so much for being here.
It's always a pleasure. Thanks for having me.
And it's always timely to talk about mental health, isn't it?
That is so true.
Yeah, and even more so in the pandemic. I was telling you during the break that as Dr. Gale was talking about trauma and what people have experienced in this country, whether involved in crime or anything else, there are a lot of mental health struggles that people are facing. Mm-hmm. And so I kind of just want to start with the situation that we know on the ground.
There's a lot on the ground right now, that's the thing. Mm-hmm. But I think this COVID-19 pandemic, it has been a double whammy for mental health, in the sense that for those with pre-existing conditions, the pandemic has made it a bit worse for them. And the pandemic has created new conditions, as in not new conditions, as in new cases. So we have an increase in a lot of cases now due to this pandemic that we're living in right now.
What are the top issues that we're seeing?
The most common is still anxiety and depression.
Yeah.
But then you don't want to forget about the other disorders either. People suffering with post-traumatic stress, that also has increased, by the way. And psychosis, bipolar, so some of these more serious conditions. People who have already been living with those conditions.
And
the pandemic didn't make it any easier for them.
Yeah, that's what I was going to ask. You know, you say we see an increase, but in terms of people's ability to, let's say, access treatment or deal with the problem in some way, how has that also increased, or what are we seeing in terms of how people are coping?
COVID-19 has significantly impacted mental health. Our mental health, yes, we know that. We've been talking about that for some time. But it also have a significant impact on our services. Because you notice now that the Ministry of Health and Wellness had to shift focus, and we have to take care of people who are becoming infected. We have to take care of this country. We have to try to prevent these infections and we're pushing this vaccination, you know, head over heels we are. So that things, that other conditions, other situation had to, you know, take a little back seat. And unfortunately for us, our services has been impacted significantly. We don't have enough staff for the increase in the new cases that I just mentioned. So we have people on waiting lists. How sad is that?
What?
To wait for. So the access has been impacted.
I'm sorry if I side like that. It's just the fact that we know it takes a lot for people in our culture to reach out for help.
Right.
And then to reach out for help and to be told, kind of wait your slot or till someone is available, has to be a challenging thing from your end to do. But it does require, your job requires that you put in the right amount of time with each client.
Right. We want to continue to give the best service.
Yes.
And our patients, our clients deserve that and want that.
Yeah.
And we as the professional, that's what we're trained to do.
Yeah.
If it's free or if you're paying for it, you want to give that person the best.
So mental health service in Belize is like another COVID unit, waiting for the space to be able to get treatment.
Sometimes I joke around with people, and it comes out as a joke, but I'm dead serious that the pandemic is mental health.
Yeah. And I think the mental health of the majority have been infected, more persons than those who've had COVID.
Right.
But what's the concern here? What's the larger concern? I know we talked, well, you've done interviews before talking about the situation of suicide in the country.
Right.
And then we have seen a rise in
increase
numbers.
in suicide.
We
yes.
don't report it, so maybe the public isn't aware. But give us a bit of clarity on that picture.
Well, that is for sure. This pandemic year and months definitely increased all conditions, including thoughts about suicide, suicidal behavior. So we're not just talking about complete suicide, we're talking about just having the thoughts. I mean, a lot of our adolescents are struggling. Even just young adults are struggling with, we can't do anything. This is the time of their life where they're being so sociable, and they have to control that. They are forced to control that. So many are struggling with thoughts, so why be here? What are we supposed to do? So this is very difficult. It creates the anxiety, the depression comes on. And when depression gets serious and severe, suicidal thoughts come. So if you hear about a suicide, you get to hear about one. But what you really don't hear is about all the attempts, all the thoughts that people have about it. So the number is bigger than you can ever imagine.
And do you think that also, given all of this increasing stress and anxiety and the conditions that people have been under that have caused the increase in incidences of mental health issues, do you think that the population, let's say, or most people do they have the knowledge to even recognize when they have the problem? And so that they can, you know, address it or deal with it in a healthier, constructive way?
Not to the level where we would want it. I can safely say that there's a lot going on. A lot of people are suffering, and it's undetected and of course not treated. And then that will, you know, continue to persist and get worse as they continue to grow. When I'm saying that, I'm thinking about adolescence, because a lot of it begin at the age of 14. So between, let's say, 14 and 25, that went undiagnosed, untreated. So after that, it just comes worse when it starts impacting your function.
As we approach World Mental Health Day, let me ask you, what's the global conversation like at this moment about how we prepare ourselves for what's to come? In other words, what we're living through right now and the effect it is having on our mental health. Some of these we won't see until after the pandemic. What will be the impact of 14-year-olds who needed that social interaction to kind of build their own development, that they didn't have it, that they'll be delayed? Is there any talk of looking at to what the long-term impacts will be and what will be done to address it?
Well, yes, we're definitely concerned about the long-term impact and how will we address it. So we want to make sure that we're ready, that we're accessible to everyone who needs our help. So that is kind of like at the forefront of our mind, to make sure that we're there for when they are ready, for when we go back to what we want as our normalcy, that we are ready for them, and that they are in a place that can come out and talk about it. Because right now, this year, the theme for World Mental Health Day is mental health in an unequal world. And if you talk, well, I wanted to bring somebody with me up here. And honestly, I contacted 7 people, and all 7 said no. Why do you think is that?
A person with mental health?
Yes.
Oh, they're scared of stigma.
Of course.
Yeah, absolutely.
I had 2 people who really wanted, and they would say, I know I could help you, but I have to think about my reputation. I have to think about my children's reputation. So they couldn't make it, as much as they know the importance of talking about mental health. The more we talk about mental health, the more we're fighting that stigma.
And I mean, is it all, are we seeing manifestations or people are treated differently if they say, I have anxiety or depression, or I'm bipolar, or I have some other issue that I am addressing?
All right. We have made some huge improvement with anxiety and depression. It has become more widely accepted. Some people even say it has become medicalized, in that people now say it like you say, like you said just now, I have anxiety, I have depression. They're not saying, I feel depressed, I feel anxious. So they kind of medicalize it and saying, you know, like I have diabetes. So that's what they're doing now. So it has become accepted in that sense. The other disorders, the more serious ones, no, you won't hear anyone say, I have bipolar. I have schizophrenia.
But I think that also brings up a very, you know, important idea, because a lot of, increasingly, and this is just my sort of reaction, and you as a professional probably know more, is that people are starting to now put mental health on the same level as, let's say, physical health. So when you say things like, you know, people come, I have anxiety or whatever, in the same way that people would say, I have this other disease, people are recognizing that, yes, it's a medical condition, and that it needs the same level of attention and treatment. And have you noticed that people are changing their understanding of mental health in general? And has that been, you know, beneficial in any way?
It is. I see more people coming for the services. So they're willing to get help. They recognize that they need help. They will do better with help. But then they want to do that in so privately. That nobody needs to know. I mean, right at our clinic, right at Port Loyola, where all our services are at right now, you know, people are asking if we would do it privately.
Because they don't want to be seen.
They don't want to be seen.
Is that, I mean, do you also use virtual? Is that one way that you could?
Due to the pandemic situation, yes. So we're kind of a blended services right now. So, well, at least my services that I can offer. I do virtual and I do still do face-to-face. But some of the other services has to be face-to-face. You know, I mean, you know, for those who are receiving treatment as in oral treatment or injections, they have to be seen by the nurse or the doctor.
Yeah, yeah. Juliet, if you were to pinpoint what you think is kind of the biggest concern for the mental health of the people in this country, what would that be?
Access to service.
Qualified professionals? Number of qualified professionals?
Definitely. It has, but in the Ministry of Health and Wellness, our staff is still very small. We have trained nurses we have nurses that are trained in psychiatric nursing that are working in the hospitals. Because you know the condition we are in right now. We are short on nurses across this country. So they are needed also in the hospitals. So that the ones that remain in the mental health clinics are strained right now. And it's really important for us to take care of ourselves. I mean, you should hear us how we talk at the clinic. We're always looking out for each other and remember, take care of yourself. We have to control that as much as we can. Not just because we don't want to become infected with COVID. That's number one. We don't want to take it home to our families. But we want to continue to provide this service. If there's an outbreak at our clinic, you know how that will affect how many people? To shut down a mental health clinic, that's over 400 people can't get services for a couple of weeks. So I feel like we're under pressure to make sure that we provide the service because we know the importance of it. So it's not a selfish act at all for us. We want to be there.
I was gonna go back to something that you mentioned briefly earlier, but if we could like have a little, or you know, shed a little bit more light on issues relating to how the pandemic has affected children, because you know you mentioned you know the problems that can be caused you know from like let's say the lack of schooling and the social setting, but there's other issues. There may be family issues and all sorts of things going on at home that they're dealing with in addition to that. So can you talk a little bit about the mental effects on young people, children, and what perhaps you've been observing that the pandemic has brought on?
It has affected them, you know. With children, you either see they're acting out a little bit more. I mean, you've been in, let's call it closed spaces for too long. You're being at home. Their socialization is going on. And if you're one of those families who's extra careful, you don't want your kid to go over to the neighbors to play because you don't know who they entertain at their house and you know who is in and out, and for those reasons. So there's a lot of screen time also going on, which we usually would have asked to control. But how can we do that now when school is online? Online is how we entertain. Online is how we communicate and socialize. So then there is always the backlash of that will be some acting out where they won't want to do other things. Well, they turn against school activities right now. So school have to be becoming very creative, that everything can't be done really on the screen, but sometimes outside of that.
And the parents sometimes they don't know necessarily how,
and yes, it does have an effect on the parents as well.
And they have to be teachers now in some cases. And also if there is and then we also spoke a little bit in our first conversation about how the pandemic has increased domestic violence, you know, in the general sense, family, you know, it could be abuse to children, or they're witnessing abuse if it's happening. So that's also.
One of the things people normally do for their own self-care is outings. People hang out, they go out to eat, they go
get out of the house.
They get away, they go hang at the park. They do different things for their own self-care, which is part of mental health. But all of that has been very limited. So yes, it affects how we will relate to each other. So our patience is significantly reduced. I can't cope so well because I need a break. And I want to get away, and we can't do it.
And adapting to the change in itself. That's difficult on people who maybe think they have no mental health issues.
Right.
How do we use the opportunity of World Mental Health Day to shine a spotlight on what's going on and how to help people who haven't even tried to access help?
Well, what we're doing this year is definitely, we're always trying to create more awareness on mental health.
Yeah.
But this year, the focus is on, we need more investment in mental health. We want that to be heard. We want people to be able to feel comfortable talking about mental health. So if everybody feels comfortable talking, we believe there will be more investment in mental health. Because if you suffer in silence, and we don't know.
And even if you're being treated in silence, if you have access to mental health, it's kind of getting more comfortable being able to say it as well. But how do you bridge the gap of trained personnel? You rightly said the nurses are needed for physical health care, although they're trained to provide psychiatric care as well. So is there perhaps, like with lawyers, they do pro bono cases, or there's legal aid? Are there other agencies that complement to provide free services?
Well, definitely. I think people in mental health are special people, as in our hearts are made differently. So yes, it's not so much about making the money. A lot of people in private, yes, are offering the pro bono and the free services. And you hear them, they're on social media, they're promoting it, that please come. This is what we're here for.
But still not enough.
But that still is not enough to the amount of people who we suspect would need help. I mean, the bulk of the professionals in mental health are here in Belize City.
That's true.
It's not just people in Belize City that are affected with mental health issues.
Wow.
Yeah, I was also gonna ask, about the impact on the mental health, service providers, because of course with the increase in cases and the more strain on the system, and everything that the pandemic has caused to it must have, made your jobs harder as well. So is there also, mechanisms that provide, let's say, relief or services for you all as well to provide that additional support?
Not, I think so. No, we're doing what we can with what we have. And that's all I think we can do. But we're still doing as much. I can't say it any other way. We're doing all that we can do.
Yeah. Juliet, I mean, that's heavy stuff. I think the idea that there's such a great need for service, and those who can provide it are stretched thin.
We are
in being able to offer what they can. Because with all healthcare, physical and mental, you can't cut corners. The doctor can't decide I'll only sew up half the stitch. And the therapist or the psychiatrist can't say I'll only listen to half your problem.
Right.
So it's critical that you put in that time. So it's understood there are people in society right now who are struggling. Are there things we can do or need to do to minimize reaching the point where we have a mental health crisis?
Well, definitely, you want to take care of your mental health. And to have good mental health, it means that you can cope with life struggles, with life stresses, the normal ones that come, that you don't lose your balance, let's say. So if your car breaks down and you're out of a car for a week, how does that affect your mental health? These things can happen. I mean, does that really throw you out of whack? Does that mean your mood will definitely be affected, but how severely will that be? Can you still manage? Or will you go into a drinking spiral, But that's another one too, the increase in use of mood substance, which includes the alcohol and the other drugs. So that's another one that we have been paying attention to as well. But back to maintaining good mental health is that we want to remember that you need to take care of yourself, to do what you do, to take care of your kids, to perform well at your job. You need to take care of yourself.
Yeah.
And that includes your mental health, which means you need to get good sleep.
Like that
no.
Why did you
That
start
was
that one? Yeah, it was like, okay, let me go through this checklist with you, but I started on the wrong foot.
Yeah. So good sleep is definitely one. You want to try to have how close can you come to having a balanced diet? To eat well, to feed the brain well, so you have the right amount of energy to get around to do what you need to do. And when you feel stress, you need to manage that. What do you do to manage some little stressor that happened at work or at home? You take a 5-minute break, you listen to some music, you take a walk around, up and down the street somewhere, do something, or talk about it. Because that is another big one, talk.
Yeah.
So you need to have somebody that you could confide in, a good friend, a close relative that you can talk to.
Yeah, that's key.
Be active is another big one. We want to promote being active, as in you either get some exercise or other activities that you enjoy. And for those that are at home, come outside and get some sunlight. You don't want to be staying indoors all day for a whole week or more. Come outside.
All right. I know we're totally out of time at this point, but Juliet, is there anything that is going to happen that people can participate in? Any advice to the wider public that you'd like to close off with?
Well, World Mental Health Day is October 10th, so that's Sunday. So this is observed yearly, worldwide. The theme this year is, mental health in an unequal world. We're trying to bridge that gap as much as possible. We're doing a lot of these type of shows. We're creating as much awareness as possible. Some of the district staff were able to organize competitions with the schools. So there's more awareness going on there. The Mental Health Association is also doing their usual speech competition.
Oh yes, the virtual speech.
Yeah, the virtual speech competition. So that's going to be going through as well.
All right. And if people need to access services, where do we tell them to go?
So here in Belize City, all of mental health services is located at one place, which is the Port Loyola Health Center, which is on Farbers Road. In the districts, the clinics are still attached to the hospitals, so you can find a psychiatrist and a psychiatric nurse.
All right.
Well, Juliet, thank you so much for coming in and sharing all about World Mental Health Day. We definitely appreciate it.
Thank you, thank you.
All right.
And with that,
And take care of yourself.
Yes, please be safe. With that, we are going to be taking another short break, and when we come back, we're going to be hearing all about the latest exciting fundraiser from Autism Belize. So please stay tuned, and we'll be right back.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.